All right, we're getting to the end here, and I'm going to be able to pass it along to my colleagues fairly soon. But there's just some points on templating. This point here, I'm going to show you these images. There's a prior femoral fracture with retained hardware, and the point is about what type of prosthesis is needed. The importance of this question is if you look at this, what's drawn for you, where they show you this weight-bearing line, which looks like it goes through the middle of the femoral head, the middle of the joint. And on the lateral view, it doesn't look like there's a whole lot of deformity that's large enough that you have to do anything heroic. This is one where they're proposing you could use a pretty straightforward knee design because the frontal and lateral plane sort of abnormality is not so much that you need to do something like customized implants or an extra-articular osteotomy or even a hinge, because what's going on at the knee is manageable with a straightforward prosthesis. Well, why do you template? You want to anticipate the size and position of the knee implants prior to surgery. I think it's important, certainly more and more important potentially as we consider trying to sort of smart template for cases, but it does let you sort of have a reliable start point. The accuracy depends on sort of how much effort you put into it, but certainly you should be able to get within one size up or down. And how you do this can vary, but certainly you want to have good, appropriate AP and lateral views. And the ability to template both the femoral and tibial component and understand the scale you might be dealing with. Weight-bearing films are critical. The lateral view is very helpful for templating. I don't think the patellofemoral joint view is that critical. I like to use a long-standing film as well. That's pointed out here. That can be used for templating. That can help you avoid those cases where you might need to do something about an extra-articular deformity, but it helps allow for planning of bone cuts. Think about most magnification through most systems. 20% is standard. I think if you use a digital templating system and a reference sphere or something like that, you're going to be more accurate than that. I do like to draw a line of also middle of the femoral head to the center of the ankle, get an idea for what your mechanical axis is. I also like to break these things out and draw not only what's shown here as the anatomic axis for the femur and the anatomic axis for the tibia, but also then sort of determine the difference between the femoral axis, be it the anatomic and mechanical, and that gives you an idea what that number is. We often just use a 5-degree jig, but the point here is that you can actually measure this and understand there's variability, that 5 degrees may not be the ideal for each patient. The tibial cut, it's nice to draw a line, center of the ankle, center of the tibia, perpendicular to that, make planar tibial cut. And then assessing bony defects and osteophytes, I think that's easiest on the AP view for sure. I use an implant design that allows me to match or tells me to match the native slope. So this is a nice thing to do and measure on the lateral radiograph. We think that's an important point to point out. It's important to think about patellar height, think about things like range of motion and concern about patella baja and what that might mean for exposure. I think this is very helpful. You want to make sure you know what the patella looks like so you can plan the appropriate resection. What you take off should look like the appropriate resection, and certainly helps you with tracking issues, making sure you know how much lateral release is done. So you template the femur on the lateral x-ray. You want to restore posterior condylar offset and avoid notching, and then assess that size on the AP view, trying to make sure you minimize overhang. On the tibial side, again, template to whatever slope you want. On the AP radiograph and the lateral radiograph, you want to make sure you avoid oversizing, consider downsizing if that's present.
If you enjoyed this video, please consider leaving a like. We'd love to hear your thoughts and what you'd like to see next in the comments. Don't forget to subscribe to our channel and follow us on social media.